Hello and thank you for joining us. And what we're going to talk about today is we're going to talk about the concept of retention. Now, if you're someone my age or older and you had braces as a child, you probably went through a very similar experience that I went through. You wore braces for a period of time, you got your teeth aligned, and when you were finished, your orthodontist recommended wearing something like this, which is a type of retainer, for about a year. And the concept of wearing it for about a year is that we know biologically when we move teeth, there's forces that want to pull them back to their original position. We know after about 9 months those forces wear out, and so wearing a retainer for about a year usually is enough time to prevent orthodontic relapse, or so we thought. And what's happened over time is you've had a greater understanding of why teeth move. And true, when we move a tooth orthodontically, it does want to move back, but teeth can move at anybody at any age, whether they've had braces or not. Because the reason a tooth moves is that there's a force placed upon it. We do it with conventional orthodontics, but even for someone that never had braces, they still have forces on their teeth, forces from their tongue, their speech, their lips. They can move a tooth at any age, coupled with the fact that as we age, our bone level or bone quality decreases, and good bone is one of the things that prevents teeth from moving. So you can have a patient that never had braces, teeth remained in a very stable position. All of a sudden, as they get older, the bone level decreases, or for females, osteoporosis. They go through this sometimes even with pregnancy. And then the minimal forces that were never strong enough to move a tooth tend to want to move a tooth. And so what we really understand now is the concept of wearing retainers for life. I mean, think about it. When I was a child and I went to a wonderful orthodontist, did a great job, straightened out my teeth, gave me a retainer to wear. I wore it diligently for a year. I'm very happy with how my teeth looked. And he said, okay, you don't need to wear it anymore, just throw it out. Realizing the teeth will move at any age, that really doesn't make as much sense anymore. You own the retainer, you're wearing it, you're doing a good job. Instead of throwing it out, why not continue to wear it? And so the question I get all the time from my patients is, how often do I need to wear my retainer? And the real answer is enough to do the job. What is the purpose of a retainer? It's to hold the teeth in their current position. And so you have to wear the retainer enough to do that. For some people, it's all the time for a period of time, eventually going to just at night. For other people, they're okay wearing it a couple of nights a week, and there are some people who are okay wearing it one night a week or one night a month. I even have patients who get very lucky and their teeth don't move at all, and my recommendation for them is at least try on your retainer once a week, once every other week, as a test to see if the teeth have moved. If the retainer feels comfortable, then whatever amount you're wearing the retainer is good, it's working, teeth are staying in their position, and that's wonderful. But if you haven't worn your retainer in a while, or you're trying to cut back and you put the retainer in and it feels tight, then that's a pretty good sign that during the time you were not wearing your retainer, your teeth have moved ever so slightly. And whatever time that is for you as an individual, you just need to wear that retainer a little more. So if you were putting it in every other night and you put it in and the retainer feels normal, every other night is good for you. It may not be for your best friend, but it's perfect for you. If, on the other hand, you're wearing the retainer every other night and it gets tight when you put it in, then for the time being, you're one of the people that needs to wear it every night. And that will change throughout time. Sometimes you go through periods where you're stressed more, your teeth want to move more, and you have to wear your retainer more frequently. And then other times you go through periods where you don't need to wear the retainer that much at all. But I would always stress with my patients to make sure you at least try it in periodically as a constant feedback to give you the information to know how often to wear the retainers. And I even tell them, by doing that, you're going to know better and quicker than I'll know by seeing you how much they're moving. Because if your tooth moves a 0.5 millimeter, I may not see it, even with my loupes. But you'll feel it with the retainer. And so, again, I encourage my patients to just try on that retainer periodically. While we're talking about retainers, I thought it'd be a good idea to do a brief review of probably the 3 most common retainers that are used today. The first one that I showed you before is called a Hawley retainer. And the advantage of a Hawley retainer is that it is removable. Patients can take it in and out to eat. It The acrylic is very strong. It's meant to last a long time. No one's going to tell you the retainer is going to last the rest of your life, but you should be able to get a good 5-10 years out of a retainer if you're careful with it. And it allows, because it doesn't cover the tops of your teeth, I like using a retainer like this when the braces come off because it allows for something called settling. And what that means, and when I took my boards, they told me this was a very important concept. When the braces come off, you have the teeth in an excellent position, but because of the shapes of the top and bottom teeth, over time, they will tend to erupt and come together, and the occlusion, the bite, will actually improve typically over the first month or two after the braces come off, as long as you don't have a retainer that's going to get in the way. And so this is called a Hawley retainer, and it's one of the retainers I like to use the most. This is called a bonded retainer or a splint, and it is a wire that's glued individually to each tooth behind usually the front 6 teeth. This retainer also allows for settling, allows the teeth to erupt and come into contact with the opposing arch. The advantage of this retainer, and I like using this, I've been using this more and more, is that it holds onto those front 6 teeth, which are the ones that are most prone to relapse. Holds onto them very well and very securely, just like your braces did. The disadvantage of this retainer is if you have a patient that has questionable hygiene, it can tend to get calculus or plaque build upon there and may need more frequent cleanings. Also, because it's bonded and connected to all 6 front teeth, patients can get a false sense of security. So what do I mean by that? If it's connected to all 6 teeth and it comes off, gets unattached to one of the teeth on the end, the patient will often feel it moving and know they have to come in to see us. But what if it gets detached from one of the front teeth? It's still connected on either side, and so the patient won't feel the retainer move, won't know something's loose unless one of the front teeth start moving forward, and by the time they notice it, it's a little too late. But if you have a patient that's going to be careful with their hygiene, reasonably careful with what they eat, I find this is an excellent retainer, especially for the bottom teeth, which are the ones that are most prone to relapse. The third type of retainer is called an Essex retainer or a Truetain. There's a variety of different names. It's a clear plastic shell that's meant to fit on top of the teeth. This was not made for this patient. And as you can probably guess, because it covers the top teeth, the tops of the teeth, it doesn't allow that settling to occur. So I very rarely will try to use a retainer like this immediately when the braces come off. But it is the most comfortable retainer we have. It's one that we can get back from the lab very, very quickly. It's usually the most cost-effective option that we have. And so I really like to use this retainer if a patient loses the first type, the settling has occurred, and I know I can get this into their mouth very, very quickly. The other advantage to this type of retainer is if you start off with a patient that has an open bite, meaning their front teeth don't come together, and we finally pull them together, this is an excellent retainer to help with stability in a case like that. The third reason I like to use this type of retainer is if I have a patient that I think is a grinder, and I'm worried that they're going to start wearing down their teeth. I like to use this retainer because even though a patient may think that they have a grinding habit, it's a really good test. I give this retainer to the patient and I tell them, we're going to find out how bad your grinding is. If you come back and see me in 3 or 6 months and you have ground little holes in the retainer, then we know you have a bad grinding habit and you probably want to go see your dentist to have a more heavy-duty mouth guard made. On the other hand, even though you may think you're grinding, if you come see me in 6 or 9 or 12 months and there's no holes in this and it looks almost as clean and good as the day we put it in, then we've pretty much ruled out that you have a grinding problem and one less thing to worry about. So anyway, I hope that made sense. It's a brief review of why we use retainers, why we use them for life now, and the basic different types. I hope you enjoyed this blog.